Thank you so much, people online and the participants here. And I like to stand on the existing protocol. And thank you, Dr. Mensah, for saying that, because I'm usually not good at it. So thank you so much for saving me from the trouble. But I'd like to start by thanking the organizers of the meeting, particularly for inviting us at the National Health Research Ethics Committee to collaborate with them in co-hosting this event today. It's been a wonderful experience for us, and thank you for giving us the opportunity. But I'd like to start my, my keynote with a story. And I'm not a good storyteller, so it's not my story. But it was a story that came to my mind when I was thinking about what to say here today. I was reminded about this story told to me by my friend. We were both strong students then in Scotland. For some of you who have been there or that part of the world, it could be very cold during winter. And he saw a little girl in the elevator when they were going up. It was eating ice cream. And the gentleman from Nigeria, of course, said, in this cold, that's not good for you. And the little guy looked up to him and he said, well, my grandmother lived to reach 107 years. And the man said, eating ice cream? And then he said, no, the girl said, no, it's got nothing to do with that. It was because my mother knew earlier on how not to meddle into people's business. So, meddling, you wonder what meddling got to do with what we are doing here today. I've been an investigator before, as many of you here. And some of us as investigators think the people in ethics are meddling with our work. They are obstructing. I want to get on with my study and get my data and papers published and become a professor. That's our ambition, isn't it? But then research to get credible data that is impactful, that will be useful to the community, we have to work together. I look around here, eminent scientists here, professors. I look at early career scientists. I look at policymakers. We have all to come together to do this together, to begin to generate credible data that can influence policy, that can impact things in Nigeria. Other people have mentioned, but I need to mention also that we cannot, I think we all agree to that we cannot achieve meaningful development in our country, actually globally, if we don't begin to take research seriously. Data is crucial. In the coming years and decades, data is crucial. Data is even going to be much more important than oil and minerals. We are beginning to see that now, don't we? Thank you. My next slide. I can do it from here. Okay, this is what I'm going to cover briefly. I've done my welcome and introduction now with a story. I'm going to look at the overview of ethics in Nigeria. What are the challenges that we face? Usually I see challenges as opportunities, but how can we turn those challenges to opportunities? And then looking forward. Well, this is not clear on my slide. But as you can see here, ethical research, and that's the essence of my story, is a shared responsibility. And it was Dr. Collins who said, ethics is not a burden. As investigators, we must see ethics not as a burden, but it is the backbone of credible science that can generate credible data. If there's any difference between those countries, those so-called developed countries and developing ones, is the emphasis and the importance that they place on generating credible data that can influence their decisions in deciding, in asking questions about what are the problems, and researching to generate relevant answers to those questions, and following up to implementing them to get results. So what is research ethics? What's research ethics? In terms of definitions and the principles of ensuring that those who participate in our projects are protected from harmful effects. We need to be honest. We need to respect individuals. Accountability in research. Are we confident with the data? You cannot sit down. I was hearing about a story when we were coming to yesterday when we were having dinner, about people who sit in the offices and just generate data and write things that are not true, that are not very close at all to what is happening. If we don't ask the right questions and generate the right answers, we cannot actually get the impact that we want in the society. What are the key pillars in ethics? It's autonomy, beneficence, non-malfeasance, justice. You know all those documents, and I don't want to bog you down with them. And global standards has also been established that we need to follow. They also were publicized by those who are familiar with those declarations globally that's applicable in our centers. What did they do is to emphasize the rules that must be engaged and regulations that Professor Adegbola has just mentioned, some of them, while she was speaking with us. What are our values? Do we just extrapolate what is happening in America or the UK to Nigeria, or do we think about our people, our communities, their sensitivities? Do we take that into consideration when we're designing our study? Do we start with them and not just talking at them? What about research itself? I sit in NIMA for the past 5 years now, supporting early career scientists. And one of the first things I ask them when they come into my office, what are subjects of your interest now? And for many of them, instead of telling me, with due respect to them, the things are changing, is that they start telling me about their degrees. Well, I did biochemistry, University of Lagos, I did PhD in Manchester. But that's what I'm asking. I'm asking, what are you doing with the PhD now? What are issues confronting us in health in Nigeria that you are addressing? If it's in malaria, what aspect of malaria is of importance to you? What are you hearing from people in the community? What's their problem? What drugs are they using? Which one is not working? Which one are you investigating? Those are the things. What are you following through? And I give myself as an example. I study pneumonia. And if you search literature, before you find 20 names, I must feature, because that's what I'm focused on. But I do other things as well. But that's my focus. What I think about every day is pneumonia. Why is pneumonia still killing children in Nigeria? Why are we the number one in the world where children under 5 years die of pneumonia? What can I do about that? What about treatment? What about vaccines available that they are not using? How can we facilitate that? I mean, is that what am I addressing that all the time, whether I'm thinking or walking or sleeping? Or what is my preoccupation in terms of values? Can I? But some of the things that we can address also are the moral principles. In ethics, knowing the difference about what is legally... yeah, no problem, thank you. Knowing the importance about what is legally required of me, and they may be different from what is morally expected of me. Is that clear? It might be legally appropriate and right to investigate a product in Nigeria for which you are going to make money, but which at the beginning it's not affordable in Nigeria. There's nothing wrong with that. Legally, you are not committing any offense. But is that morally acceptable? It shouldn't be morally acceptable. Why should you use us as guinea pigs and then make all the money in Europe? So do we think about that up front? I mean, those are the kind of issues that ethics tend to investigate and deal with. And then what are the rules of engagement? rules of conduct in terms of ethical practices. So why does research ethics matter in Nigeria? And I've listed some reasons here. Well, Professor Sage, when she was speaking, says the expansion, and Dr. Mensah as well, expansive research over time in our country. There's growing research now in terms of output, even in Nigeria, compared to what it used to be, say, decades ago, in health, in agriculture, and in technology. And because of that, there are also complications and things that we need to put into consideration when we're designing our studies. We need to put on top priority protecting participants in terms of their safety and not expose them to harms. Maintaining scientific integrity. To a scientist, integrity is the way you go about your research and calculate your data. As a scientist, that's money to me, isn't it? I mean, that's you know, like a banker thinking about not falsifying documents in his or her office. Is the way a researcher should think in his office. That this is precious, this is important to me. The credibility of the data I'm generating and pushing out. Building trust in research institutions, ensuring social responsibility. Am I just doing my research to publish my papers in a local university journals? That has no impact whatsoever. Some of my colleagues in Naimana, when they come to me, they want to put my name on the paper. And I said, but I've not done anything about the paper. I don't want you to put my name on a paper that when I come to your institute here and you're asking me about it, and I say, yeah, it was done by. No, I want to be able to talk about it. If I don't have knowledge about it, don't put my name. I can support you. I can give you such suggestions. I can facilitate. We need, those are ethical matters. Is that acceptable to me? Just putting my names. I'm addressing the right audience here because I see people who understand what I'm talking about. And that we need to really do something about this in our country. Well, and of course, we've mentioned building trust in research institutions. Why do they not have trust in us? You know, it's an argument in circle in our country. The policymakers are here. When they want to use data, they go to WHO. WHO gives you estimates, and I can tell you from experience, I've worked in tuberculosis, the estimates they give you is by far, far removed from what is happening on the ground. Estimates can only be useful when they are based on some baseline data. If you're just calculating and formulating everything in Geneva, do we blame them? No, but because we go to them. But what are we doing? We have so many universities in Nigeria. We have professors of high class that can compete anywhere. So, but where is our data? Who can give us for sure, for certainty, what's happening in our country? When we declare a disease as not available or evident, is it because we have data or because we have to say something? How efficient is our surveillance system? How complete is it? Is it look and see or something that is systematically collected over time so that we can notice spikes when they are happening and when to take actions? Or we are waiting for that to be dictated from us, from abroad? There's no way, no matter how hard they try, it cannot be as good as what you collect on the ground, isn't it? I'm sure we know that. We need to do, what does research, why does it matter in our country? We need to avoid exploitation of vulnerable populations, pregnant women, young children. We need to avoid data fraud and reputational harm. Because when they happen, even once in a while, they damage the trust and collaborative efforts that other international groups may want to have with us. And of course, because we have regulatory institutions in place, it's also required to comply so that we can comply with legal and regulatory requirements. So, Why does research ethics matter then in Nigeria? Which is what I've just done. So just basically to talk about regulatory, but things have been happening in Nigeria over time. Dr. Mensah mentioned that earlier, and I like to recognize people who have done that. We've laid ground for sound ethical research in Nigeria. I think I was made the third chair. The last time there have been Dr. Adegbola, who actually started it. The building blocks were already there. And then Professor Iliasu was the chair for the past 7 years, I think. I will talk about some of the challenges that they face, which they kindly actually sent to me, more or less a list of the challenges that we will face as a committee, which we are facing, where we are addressing them, and people are helping us to work through and to solve some of them. But there were earlier attempts in the 80s to establish research regulatory agency. The Ethics Committee was not very active then because of several reasons, including limited interest, lack of funding, and low levels of research activities. That has tremendously changed, as we mentioned. Research activities continue without adequate regulation, but those are now in place. This might have led to various scientific and ethical lapses in research in the country. Because there was no regulation, everybody was doing their own thing in their own corners. And of course, the example of the 1996 Vice-Adjutant clinical trial is one that probably can be vividly remembered by some of the participants here who were around then. The study was associated with abuse of vulnerable research participants. It led to liabilities, as some of you might know, that was settled out of court run into millions of dollars, and I think establishment of an institute in Kano. I think I've covered that also to some extent because of time, but clearly the need for establishing ethical principles in Nigeria was influenced by a history of research abuses, both in our country and abroad, international research environments, because of health reforms in Nigeria and need to protect research participants. And so what do we have in place? That started with National Health Research Ethics Committee, which was set up in 2006, backed by National Health Act, which I'm going to talk about later. There were 15 members in them, including a chairman, other members from various disciplines. And I want you to take note of that it's not just ethics that they are talking about. They talk about religion, morals, and what have you. So they have people who are lawyers, pharmacy, all these disciplines were represented, including medicine, nursing, community health workers, Christians, Muslims, and researchers as well. There were ex-official members from ministries of education, environment, women's affairs, agriculture, and other line ministries, including NAFDAC and the National Universities Commission. When I saw the list, and I wonder how they were functioning then and taking decisions, it really was a large, a committee with a large membership. But then came the 2014, talking about the structures now that we have in place for the management of health research ethics in Nigeria. The National Act of 2014 provided a sound basis for the establishment of the National Health Research Ethics Committee by the Honorable Minister of Health. So we are accountable actually currently. The committee is accountable to the Federal Honorable Minister of Health. It specified its composition, the roles and responsibility, and the NHREC, as we have it of today, actually derives his powers and activities backed by the Act. What are the main functions of the National Health Research Ethics Committee? Is to determine the guidelines for the functioning of the health research ethics committees in the countries and the IRBs. We are to register and audit the research ethics committees in the states and the IRBs. We are to set norms and standards for conducting research on humans and animals, including those for conducting clinical trials. We also even have a role of educating if there were complaints about the functioning of the ethics committee, and here any complaint they may have, if they disagree with the opinions of the ethics committees, if they believe that they have been discriminated against by their decisions. So I'm now going to focus on, so that's what we have in place in terms of the setting in which we're operating. And I've actually also had the opportunity of participating the meeting of the head of ethics in other countries. And I think singularly because of the act in terms of law that has established the NHREC, or the National Ethics Committee in Nigeria, we are really right in the forefront and empowered to do many things that other countries in Africa cannot do, and they look up to us. But we are going to talk about the gaps and the challenges that we are facing. The key challenges in Nigeria in terms of overview, I'm sure many of you would list several more than what I've listed here. I've just restricted myself to a few because of time. And it's this weak regulatory environment. There's limited awareness and training. I'm not quite sure, even in our community, how many people understand what ethics is, even among the researchers in the research community. There's funding constraints, and that's really the elephant in the room, and I'm going to talk about that more later. And of course, there's cultural dilemma in terms of community versus individual consent. You know, and I'm going to start just briefly a story again about the last one before I go on, because I've had practical experience with that. I'm sure maybe several of you here have held NIH grants in the past, and if it has to do with clinical trials, the document that you will complete and fill to do their study is humongous. It's unbelievable. In fact, the money they spend in monitoring that is sometimes really like 50% of the money they give you to do the study. And they ask you strange questions that you have to ask, which is not appropriate in our setting, the communities that we work in. And you have to battle with them. You know, the reason why I'm emphasizing this is that we often forget sometimes that those who pay the piper, they'll have to dictate the tune. No matter how hard we want to pretend or try hard, if every time we have to be completely dependent on funding, even basic studies like surveillance, I don't know why any country should expect another country to fund surveillance for them. It should be a routine thing that government does to collect information about what's happening in your country. When you've identified the problem and the solution that they want to prefer, then you can go to people to help you. But if you have to wait, and I remember I worked with Gates Foundation for about 3 years in Seattle, for some time I was a miserable person, a Nigerian, a proud Nigerian. I never changed my passport, despite the number of years I spent abroad. I'm very proud of the green passport. That's true, yeah. Yeah, sure, yeah. Thank you. Yeah, but then you sit there, and then you see countries in Africa asking Gates Foundation to fund surveillance. That's ridiculous. We're inviting them to come and identify our problems for us. You have to know what your problems are if you want people to help you. And those are the scientists around. Please ask local questions. Nigeria is a virgin land for research. We have so many issues that are demanding focus, asking the right questions, and providing answers that can solve our problems. But I think I should go on. So just talking briefly about each one of those. One of them, as I mentioned, is the regulatory issue. That's my first, yes. And so and you can see the challenge that the former two chairs, as I went back to their notes, I see that they've actually, they mentioned all of this in the letters, passing on letter that they sent to me when I started. And the National Health Research Ethics Committee formed, on a sand basis, on that solid ground with the acts or the law, which we can cite. But we lack enforcement power. What is that enforcement power? We don't have money. We've not done a single, I was telling Dr. Mafia yesterday, we've not done a single oversight responsibility since over 1 year now. Because we don't, you don't have, well, most of our members are professors and lecturers in the university. You don't expect them to use their salary to go to Maiduguri or to Calabar to start looking at clinical trials sites to see whether they are actually asking the appropriate questions for consent. So we can do better. We can do better. The universities and teaching hospitals often have under-resourced ethics committee and IRBs. I think some of them are here and they'll be sharing their experience in the next few days. You know, by law, each state in Nigeria, which is beautiful, each state in Nigeria has, by law, the ethics committee, health research ethics committees. Look at how many universities that we have. Look at how many teaching hospitals, which are IRBs. So in terms of the grand play out, we are right in front. The problem is, are they functioning? Borno State, with an eminent university of Maiduguri, all the applications, I'm sorry I'm mentioning Borno, but you can say, I'm from Oyo State, you can say the same about Oyo State. Okay, I think Oyo State is benefiting from the usage. But the point is that there is no single IRB that's working there. All the applications come to us, and I'm sure not all of them. So that means there must be some unethical studies that are going on. I use Borno as an example. I'm sure that's happening in several other states. We don't have functioning. They are there on paper. You know, when I don't know if I do Dan Ladis, our desk officer, if he's here, but when we're asking him to invite people to this meeting, I mean, we only see, you see chair and secretary, but there are no names. That's suggesting that they are probably not functioning. I mean, that's the kind of thing that we are facing. So in terms of on paper, we have something that should be working, but it's not working. And we don't have the wherewithal to follow through with that to make sure that those things are happening as they should. I think I needed to highlight things like this in our discussions. Please, one of the things I want to say, take away from this 3-day meeting is suggestions about, I don't like identifying problems without finding solutions. It's suggestions about, please be practical in your group discussions. Look, what can we do to sort out these problems? So that hopefully the next chair of NHREC we'll be repeating what the others have done for decades now. The case studies. There have been several reports, some of them we are testifying to that, of studies conducted across the country without informed consent due to poor oversight. Or the informed consent are not actually informed, if you know what I mean. It's if just collecting people to say documentation to say I spoke to the participant. I do not take for a moment the argument that people say that they don't understand. In fact, when I talk globally about that, I refuse it profusely. Because somebody hasn't been to school doesn't mean he's stupid. It's just that the investigator is not ready to sit down and take the extra time to explain. Even for some of us that are knowledgeable in biology, if they start talking about research in physics, you may not understand. Of course, you will understand if they sit down with you and explain. I've done that. So I know what I'm talking about. I've done clinical trials in villages. and you can sit down with them. They're not stupid. They know what happens to their children when they have malaria or when they have pneumonia. I've seen more than telling me our children are not dying anymore because of your intervention. And I ask, how do you know? You don't do research. How do you know that? You know what they tell me? So that road leading to that bush, that's where they go to bury the children, but they don't go there anymore. That's fantastic statistics. Better than what you confidence intervals that you will see in Lancet. That will bring tears to my face, that I'm doing something worthwhile here. If a mother who doesn't know about statistics can tell you, I can see effect in my community, because we don't go to that bush anymore. That's what I'm not telling story. That's what I've had experience practically. That's what I mean. Making effort to make sure that people understand what you are doing. Please don't take it that they can't understand. That's nonsense. They can understand if you make effort and spend time with them to do that. So this one I just mentioned briefly, the challenge about cultural and socioeconomic factor. So communal decision-making versus individual consent. Ethics requires informed consent, that you've taken time to explain to the individual that you understand the study, you understand there's some risks and the benefits, and so it's able to take a decision that this is good for me. As it may be good for the community, not good for him or her. He may still decide to say, look, I'll do that because of community, but you need to take time as investigators to make sure that they understand that they are not joining because of poverty. That participants may consent due to financial incentives. That doesn't mean don't give them incentives. I know this is controversial because they often say because we are poor in Africa, you don't offer people incentives. Then I go to the UK or to the US and I see adverts, Dr. Adeyemi, adverts that say you can go and participate in the vaccine trial and then you are going to collect $50. So why is it good there and not good here? So how are we resolving that? How are we addressing that? And it's coming from what I said earlier, that if the fact that you're poor doesn't mean you're stupid. I mean, so we need to put on our own cases, what I'm trying to say, argue here. And there's a quote here in several studies that some of you must have seen. They said, if the chief agrees, we all agree. I mean, that's not informed consent. Yes, or if the pastor agrees, or if the imam agrees, we all agree. That means you've not done, your effort is not sufficient. I'm not saying I hope you get what I'm trying to say. It has to go beyond the pastor, behind the imam, beyond, of course, an individual can make a decision if you take time to explain to them. And of course, yes. So for me, the major problem that we have faced actually so far is finance. I think I've been lucky with the team that we have now. We have people who are willing to actually delve into this and facilitate high standard of ethical conduct of research in Nigeria, but we are limited by funding. The Dr. Ijaodola is here from the Ministry of Health. I testify to that. I mean, there's the ministry, they are trying to help us as much as we can, but there are bottlenecks because of the way the government functions in terms of their money release. And as I stand here as chair of Ethics Committee for over a year, I don't know what our budget is. And I'd like to know, I'd like all the members to know. I mean, we are Ethics Committee, we need to be transparent. But I guess the government doesn't work that way. Anyway, I'm trying to understand, but it's so hard for me. We've got some money from USCDC. I want to thank them before the presidential order. But they supported us in building an e-portal that I think, as the Minister of Education said, could transform the way we actually process applications, do reviews, and do approval over time. WHO has helped us to support the first face-to-face meeting and organize a training session for members, which was quite commendable. Do you know, despite the lack of funding that we face, we have not been allowed to be charging the applicants for submitting application to NHREC. We have now been permitted to do that. We are in the process of working that out because, honestly, if we think imaginatively and innovatively, an ethics committee can be self-sufficient in terms of funding if we are allowed to do that. The problem we face now is that even when people pay their money, again, because of the system in government, we will not have access to it because it goes to the post, the government post, and then to get that back again to us to do our work is a problem. But they are trying to help us to see if there's a way around that. Because even if we bring funding, we are not going to have access to it, which is a problem. But they're trying to resolve it for us. So currently part of, we are fortunately part of it, and thanks to Dr. Adeyemi for facilitating this. Currently we are part of a four-country clinical trial optimization project by Gates Foundation, who has now given us some money to complete that, the e-portal system so that we can begin to use it. So as you can see then, the bottom line there is that a sustainable financial strategic plan is crucial and highly required now if we are going to be able to function the way we should to do our job. So these are just I think I shouldn't. So these are just mentioning other ways. How do the NHREC translate all those things in law into practical usage that people can, investigators can apply in their studies, and what actually guide them to do that is the codes that itemize the step that you need to take to do that practically. There are other guidelines that have been developed, including the ethics code for animal studies, policy statements of establishment of biobanks and biorepositories. I know one of the issues we face with that again is that, for example, I know the biobank in Naima have been inviting NHREC to come to their facility, inspect and approve, but we cannot go there because we don't have money to send people there. And they are offering, I was actually discussing that last night, but they are offering to give us money to come and do the inspection. As chair of committee, I have a problem with that. If we have to take money to go, how can we, I don't know. Even if we try to argue that we are not influenced in writing a report, how can you take their money, they put you in a hotel, they give you per diem, and then you're going to write a bad report? I don't know. It's difficult. It may not be, but it's difficult to argue that you're not going to be influenced at all by that process. We're trying to work around that. What are the key opportunities? Because there are success stories. It's not all bad news. Several universities and teaching hospitals, and some of them, they have operational or operating ethics committees that are functioning and do their jobs appropriately. I have that problem again with I can't see my slide. Excuse, can you help me? I'm sorry. Thank you. Yeah, so I was just saying that there are success stories. One of them that I must mention is that law, that we are standing on a sand footing in terms of what we can do. What is left is making that operational. We are getting training and support through WHO, as I mentioned, in terms of collaboration. There are sub-regional organizations such as WAHO. They just told us recently that we actually have access to funding from them that we have not been using because we didn't know. And their partners such as CEPI, AVREF is a regulatory group with WHO that can provide training support for ethics committees in Nigeria. And other stakeholders are providing coordination to enhance harmonization of sub-regional ethical processes and procedures so that they can facilitate the review and processing of your protocols when you submit them. We have structures in place that's been developed by I actually found this there when I became chair, that has categorized different ethics groups in Nigeria with regards to how far they can go with review, and how they can, I think it's a very good dashboard that you can go to that will tell you where to submit your protocol. Technology and innovation can be used to actually bypass some of these things. One of them that hopefully that we're going to be launching very soon is this NHREC e-portal, which will facilitate protocol submission, review and approval process. It was launched last year in December by the Minister of Education, then the Minister of State for Health. We need to actually see, in terms of consent, that we can use app that we digitalize our system and facilitate that process. So it becomes objective instead of being subjective and standardized across the study areas. And moving forward, I thought we should also consider the use of blockchain system to enhance data transparency. I was just mentioning on this slide that we can compare it with what happened in 1996 and the study in COVID. There's been a big transformation in terms of giving consideration to not doing harmful studies to patients. So we are moving forward. I'd like to go through that carefully if I can. Can you, I'm sorry my time's up, but can I have 2 minutes, please? Thank you. So researchers in Nigeria that are in this room and listening to us, and that we can pass the messages on. We can enhance working together, ethical standard, by adopting proactive strategies that address systemic challenges, some of them that I've mentioned here, while leveraging local and global opportunities. There is need to, I guess this thing doesn't want me to continue. Excuse me. Oh, you're stopping me? Oh, I can't see my slide. Yeah, they can't even see it also. I know some system, when they don't want the speaker to go on, they block them out. I'm aware about that. So I think we need to prioritize ethics training and capacity building, strengthen community engagement, leverage technology that I've mentioned for transparency, advocate of institutional accountability, promote, I'm going to make my slides available so that you can see this later. Promote open science practice so the data are not hidden. We need to promote that in our country. I don't know your time, the professors here, each person wants to do his own thing in his own corner. That cannot be as impactful, honestly. Of course, it can give us papers and professorship, but it gets to a stage when you become a professor that what you want again is not paper, it's something that's happening in the community with your findings and whatever. For me, that's why I'm still working, actually, personally, to be candid. Address power imbalances and exploitation, enhance peer accountability network, collaborate with global partners, document and learn from past failures, and advocate for policy reforms. Recommendation for stakeholders, particularly those who are in the rooms here, policymakers, Dr. Jaudola, I'm looking at you. Allocate more funding, please take this to the ministry. More funding to promote and facilitate standardization of guidelines. Academics, eminent professors in the room, advocate for ethics training and mentorship. Mentorship, that's often lacking in our system. And the early career scientists and students in our midst, champion ethical practices early, form ethical societies, or society in health ethics, you know. And of course, the community should be involved. Remember, we all have to do this together and see the benefit of it to the community. Enhancing ethical standard requires a mix, as you have seen from my lecture, individual responsibility, institutional accountability, and systemic reforms. By adopting these approaches, we can build a culture of integrity and trust in research, improve local practices, and position Nigeria as a leader in ethical research in Africa. And we can do that. However, limited resources and financial sustainability gaps is a problem. They are a major constraint affecting efficiency of our operations, and they must be addressed. And finally, I'm almost there. Finally, please listen to this, finally. Nigeria's research future is bright. I'm convinced about that, but only if we do it together, and do it well, and do it right. Thank you.